Larkarra, and I'm an aspiring singer. Now that I'm in college and I'm learning how to be a professional singer, I have realized that vocal health takes a major role into having longevity in a career. I will be informing you about what is vocal health, what makes the voice, and the vocal disorders that can happen, but how to be healthy and how to prevent those disorders. First, I will be talking about what is vocal health. What is vocal health? I just said that already, but it is when you are aware of your voice or the sensitivity of your voice. It is how you care for it, how you feed it, and how you use it throughout the day. It can be obtained through routines. It can be obtained doing a lot of things that you wouldn't even think about that could make or break your voice. The biology of the voice. There are a lot of things that comes together to create your voice. There's a lot of muscles, there are a lot of organs, but I will be talking about four main ones. You have your vocal cords, your larynx, your lungs, and your diaphragm. Your vocal cords are the folds of the membranous tissue that project inward from the side of your larynx that has edges that vibrates in the airstream to produce the voice. Literally, I won't use my hands for this, but your vocal cords stick together like this. When you're singing, they come in like that, and they just do this little thing where you sing like, oh, oh, basically. Then you have your larynx. This is the hollow muscular organ forming a passage to the lungs holding the vocal cords. This is also known as your voice box. Then you have your lungs. These are a pair of organs that work together to contain the air and to distribute it throughout your body to create oxygen and carbon dioxide, if I'm saying it right. So basically, as you breathe in, your lungs inflate, they get bigger, creating more capacity in your chest that can help support your breath in your voice to have a more fuller sound. This then leaves the diaphragm. The diaphragm is a muscle located in your abdomen. It plays a major role in breathing and helps inflate the lungs. So basically how this works, you breathe in, you take your lungs taking all the air, it gets bigger, they inflate, your diaphragm pushed down to create more space, and you sing through your vocal cords, which vibrates to create a beautiful sound. And then once all of that air is pushed, your lungs deflate and your diaphragm pushes up. Now that I taught you the biology of your voice, I'm going to talk about the damage. Voice damage is more tragic than people actually think, because our voice is an instrument, yes, but it's not like a typical instrument. Our voice is natural because it's our body. So once you break it, it's broke. You can try to fix it, you can try to tape it and do whatever you can together, but after that, you really lose your function to what happens. You can't just be like, oh, I've hurt my voice, I have to go get it fixed. You just have to maintain a healthy voice at all times. And vocal damage can be occurred when you misuse it, when you overuse it. And when I mean overuse or misuse it, it can be incorrect use of pitch, volume, breath support, resonance, or balance, or any combination of that sort. The most damage kind of happens within the vocal cords and the larynx. Some things that can happen, but not all, is muscle tension. Muscle tension is a very common thing. And this is According to Dr. James P. Thomas, MD, a voice surgeon, is where the vocal cords typically fail to come completely together because the two muscles are pulling in the opposite direction simultaneously. This means that basically your vocal cords just can't come together. They're like pulling at each other. So it's like hard for them to they're like dead and they're just always together. Muscle tension can also result in a wobble when your tongue or a chin wobble or a tongue wobble. And you can really tell because the vibration is not a natural vibration. It's very heavy and you can tell it's kind of manufactured. Another common thing that happens in voice damage is vocal nodes. Vocal nodes are basically calluses in your vocal cords. They can prevent your vocal cords to come together. And so when your vocal cords are coming together, they're really not because of two little things are like touching each other, which creates like space in between the actual vocal cords. And then when you can tell, you'll have airiness, you won't have a full sound or vocal tone. Once you can tell you have damage, the signs of it is you're hoarse in speaking voice and singing voice, your decrease of range, you can't have a full control of your voice as you want to, like you can't do dynamics, and it's very hard to control it, especially when you want to sing quietly. You also have unsteady pitch, you're vocally fatigued always, and you have throat discomfort, pain or tightness, and also breathiness. A lot of things we do throughout the day can cause damage to our voice. Use like alcohol or smoking, which is very bad, of course, like to your body anyway, but it really dries out the voice, and your voice needs to stay lubricated at all times. When you're yelling or you're screaming or you're over talking, that can cause strainage to your voice as well, and especially overuse. And then you have violent coughing, and you have your throat clearing, which is horrible. Like that is death to your vocal cords. And when I'm saying this, your vocal cords, as you're like coughing, is going like, and they're beating against each other, so for like coming together, like they're beating after each other, which is very harmful, very, very harmful. Next, I will talk about how to prevent your damage of your vocal cords, and you'll have very, very great and healthy voice. According to Robert Thayer Sataloff of Vocal Health and Pedagogy books, vocal longevity will be achieved by attaining to vocal health through healthy voice production following the vocal hygiene program and avoiding vocal injury. So basically, that means that as long as you're having a routine, as I said before, as you keep a routine and you do it religiously, you shouldn't have a really major problem to have a healthy sound or a better sound. The thing I preach the most is you have to stay hydrated. You always have to keep your vocal cords very lubricated so it can be squeaky clean and they can just work together like they're supposed to. If you're having mucus, you can use water. Just drink water and it will cleanse you out, because mucus can have your vocal cords sticking together and they won't come together as you'll want them to. And it's very uncomfortable to have all of it in your throat. You also want to drink, I will recommend drinking like at least 64 ounces of water, but this depends on your body mass and weight. You also want to eat a well-balanced diet and eat a lot of things that are packed with vitamin C. You would also want to rest and always be relaxed. Once you relax, your body is less used to strainage and stress. Ann Peckham, author of the contemporary singer Elements of Vocal Technique, said that you should always have good posture. This also helps maximize the lung capacity and releases tension. So you should always have good posture. You should always eat well. You should always stay hydrated. And 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 use good practicing habits. Do not overuse your voice, as I already said. And once you learn those things, you should be great and you should be set. So